I witnessed, recorded, and produced these videotapes of the Washington, D.C. hearing. Their authenticity is above question.
This is produced as part of the ongoing work on the website, thewaythetruthandthelife.net.
This is a hearing about the government licensing the electrocution of people to cause grand mal seizures. Think of the millions of dollars, taxpayers' money, spent to pay psychiatrists and their supporters and for the worldwide travel in putting this conference together, while the victims and opponents had to pay their own way.
That's what I think is a very important point which is to make.
It's a generalized comment, and it relates, I think, to the risk and benefit of the treatment. So one can't address it to a singular section of this document, but I think that there is a void in this document, but the issue was discussed yesterday. It was raised by Dr. Weiss, and it is that you really should describe in the introduction the course and the devastation caused by affective disorders. And that affective disorders are lifelong, they are quite common, and they are life-threatening in the sense that they are equally severe as many cancers. It's well accepted that many cancer treatments cause great damage. Compared to those, ECT is not a very damaging treatment by any account. Furthermore, I think that it's fairly well recognized today that different strategies may be used for the stopping of an acute life-threatening episode and for the maintenance treatment. That's not clearly mentioned here. ECT is clearly efficacious in the stopping of a life-threatening episode.
And we did discuss efficaciousness in the third section.
If you then put the patient on an adequate maintenance treatment, you actually may reduce the need for further ECT. And I think that those points should be made very clear in the public record.
I'd like to go on now.
One electroshock treatment can equal the energy of 3 pistol shots to the head.
Dr. Rose accepted 2 pieces of literature for reference. I would hope you might make copies available for the panel. We're talking about having a police factor information on the device and what we're using. And the one copy is the Thymatron, the brochure on a single sheet handout on the Thymatron pulse ECT device. And in there it shows the physical characteristics. I've also included a current Winchester ammunition catalog because it shows the energy with which the bullets have. But running this machine at its maximum brings 201 joules of energy. That is 148 foot-pounds. If you're interested in actually understanding, like the truth in lending and what they're talking about, 1 joule is 0.07376 foot-pounds. But what this means is this device, when operated at its maximum capacity, will lift a 1-pound weight 148.7 feet. The energy contained in that is equivalent to 3 25 caliber pistol slugs. Now that is just pure factual data. To give that lifting of 1 pound energy equivalence in informed consent, how could you not do that? And if you're going to give a procedure, the total energy and the total time are the physical parameters that characterize the device. How could you not include that information? And if a doctor prescribes a drug, he has to record the prescription. Why isn't the total time and the total energy recorded? This has been an experimental hazardous device for years now. Why hasn't this information been gathered that we could be talking with concrete objective facts rather than subjective opinions of psychiatrists and patients?
One electroshock treatment can equal the energy of 3 pistol shots to the head.
All right, out with your gum.
Huh?
Out with your gum.
Okay, this won't hurt. It'll be over in just a moment.
Uh-huh. What's that?
Conductant.
Oh, dabble, do you? Right, Mr. Jackson?
Open your mouth.
What's that?
This will keep you from biting your tongue.
Well,
Now just bite down on it.
oh,
That's right. Just bite down.
huh?
Now bite down on it.
Good.
Are you ready? Here we go.